So I just got done recording a segment on Tipping Point on OAN, and we were talking about a law in Maine that eliminates the rights of parents and guardians to opt out for their children from the state's vaccination requirements. As I mentioned on the show, I support vaccines. I think it's stupid to welcome back diseases that we cured 100 years ago, right? You can go into cemeteries across this country and you can find gravestones where entire families were wiped out because of outbreaks of diseases that we now have eradicated, right? We shouldn't bring these back. And in a world with global travel, as we're seeing with the coronavirus, um, in a world with global travel, we cannot rely on the fact that there are no domestic cases of these diseases. We can't rely on that because, for all we know, someone could be bringing these diseases into the country, which we see it in places like Dearborn, Michigan, which has one of the highest outbreaks of measles anywhere in the country because it has such a high refugee population. Obviously, they tend to not be vaccinated statistically, but they also have people coming into the country and living in that region, bringing these kinds of diseases in. So on the show, we're talking about liberty, and it's interesting. I support vaccinations. When my son was born, I made sure to be fully vaccinated because the idea that I could accidentally give him whooping cough terrified me. Right? No one would ever want to do that. And at that time in Colorado, where we lived, there were cases of measles around. So the last thing I wanted to do was to run out to the store, pick up a bug, and bring it home to him before he had a chance to get his own vaccinations. But I also, as I mentioned on the show, I didn't really have enough time to get into this. Um, I'm also what they call vaccine injured. Now, what does that mean? 10 years ago, I had a bad reaction to a tetanus shot, tetanus vaccine. Got a really, really bad rash around my arms and legs and feet. It's nasty, and it's actually kind of chronic. It comes back from time to time. So I didn't get a tetanus shot when it came around for my booster because I'm just like, hey, I don't work in construction. I'm not around rusty nails. It's not worth it. But in order to get vaccinated for the things to protect my son, my newborn son, a couple of years ago, it's really hard because those vaccines usually come together, Tdap. So I had to have the doctor custom order my vaccine to not include tetanus, so that I could stay up to date and not have to deal with all that nonsense again. So it's interesting. I believe in vaccinations wholeheartedly. This science and the data doesn't lie. I'm also vaccine injured, and I can understand where people are coming from um, in the fear that they have. And I also believe the government shouldn't have the right to tell us what to do at all. So it's an interesting mix of ideas. But what we kind of settled on during the show is that obviously government has a compelling interest for wanting people to be vaccinated, at least in some way. But this idea that the government cannot, that the government can prohibit anyone from opting out for a deeply held religious or philosophical belief, it's maddening. We've already gone through this. We've seen the courts deal with this when it came to the Affordable Care Act. People were challenging the fact that the law required them to purchase coverage for abortifacients, drugs that cause abortion, which, as they argued, went against their religious beliefs. And the Supreme Court ruled that no, the government cannot force a closely held company to provide health insurance for its employees that also provides coverage for abortifacients or other medications that go against the ownership's deeply held religious beliefs. Government can't force you to buy a product if your religious belief or philosophical beliefs say you won't do it. That's what's going on here in Maine. As we talked about in the show, there is a reason that all of these pharmaceutical companies are dumping money into ads. This isn't out of the goodness of their heart. They want to maintain this monopoly. If this ballot initiative fails, then the people of Maine will be forced to purchase, either out of pocket or in most cases through insurance, but still purchase a product, and that company stands to gain. So that's extremely scummy. But To say that the government can force you to violate your religion, I can't see how anyone would be for that. And at the same time, I know that people abuse this. I know that people say that it's their religious beliefs or their philosophical beliefs, but I guess philosophical belief, it's easier to make that argument. But a lot of people claim it's against their religion, and I think we all know it isn't. That doesn't mean that they can't have a deeply held belief, but the idea that it's against their religious beliefs, it's a little bit overblown, in my opinion. But to say that the government can force you to buy a product, it's insane. It's insane. Now, at the same time, we didn't get to talk about this on the show because we only had 7, 8 minutes. At the same time, just as I don't think that the government should be allowed to compel someone to inject their children with a certain cocktail, medical cocktail, I also don't think that parents have a right to send their children into school completely unvaccinated. Right? It's interesting. No one is arguing that the government doesn't have at least some compelling state interest to require people either working or spending a lot of time in certain government facilities. No one's saying that the government doesn't have the power to require them to be at least vaccinated in some against some diseases. Teachers, obviously, there is a compelling argument for teachers, transit workers, doctors, nurses, anyone who works in an industry that would collapse if they were to get sick. Yes, there's a compelling government interest to require them to be vaccinated. You can't be a teacher and not have the flu vaccine. I'm sorry. If no teachers had the flu vaccine, then there would be no school. Everyone would be sick, right? You can't have doctors working in hospitals and not be vaccinated against these diseases. You can't. It would cripple our medical infrastructure. And no one's arguing at the same time that if you go into a, I don't know, a government run pool or gym, the government's not allowed to say you can't shower unless you wear shower shoes because the government doesn't want you spreading foot fungus, right? That's obviously something the government has the power to do. If the government is running a local gym or pool, then they have the right to require people to wear shower shoes when they shower to prevent the spread of disease to people at the facilities. So the real question is, how far can the government go? How far can they go in enacting these types of requirements, right? And that's where it gets murky. That's where it really gets hard to figure out. Yes, people should be vaccinated against whooping cough and measles, but is it really necessary to start giving like first graders, second graders Gardasil to protect against human papillomavirus, which is a sexually transmitted, I guess, disease? It's transmitted sexually. Do we really need elementary students to be protected from this? It just seems like a stretch. And I'm sure that there are medical reasons for it. I'm sure that there are. But the point is that there are equally valid religious and philosophical opposition to this. And part of that falls on the medical field. Part of that is that doctors need to do a better job of dissuading people from going down this road. A better job of convincing people that vaccines save lives. Listen, it's really hard to prove that something's valuable when it's so effective, it's eradicated the thing it's protecting against, right? We don't have people in this country with polio. Doctors can't just point to someone with polio and tell parents that's why you need to give your kids these vaccines. It's harder. It's harder to do because the biggest thing against vaccines is how effective they are, because they're so effective that people don't feel they're necessary anymore. But as I said, with a globalized world, you can't have open borders. I mean, that's the biggest thing. People who are anti-vaccine and pro-open border, pro-illegal immigration, that's just insane. But you can't live in a globalized world and rely on the fact that no one in your kindergarten class of 10 is going to get measles. You just can't rely on it anymore because we have people coming into our society who could be bringing things in with them. So it's an interesting argument. I think that the bill in Maine goes way too far. And obviously, I'm not a Mainer. I have no horse in this race. If I was there, I don't know how I would vote. But what I do know is that the people of Maine have the right to self determination. And if they determine that this goes too far, more power to them. That means it's up to the medical community and the experts to convince the public that they were wrong, right? Obviously, lobbyists, industry professionals have the right to lobby the legislature and get them to pass bills. But ultimately, big pharmaceutical companies don't get a vote on election day. They don't get to actually cast the ballots. It's up to the people. So if the people vote this down, it'll be interesting. I don't know if this will have. Listen, adding people to increasing the number of unvaccinated people in schools will not decrease the amount of diseases that spread. I expect to see some pretty high profile cases of once eradicated diseases popping up in Maine. It happens all across the country in areas with high opt out rates. It's going to be interesting, though, if that happens, to see whether the people stick to their guns. Because it's one thing to put up a fight against an eradicated disease, something you don't have to see, feel, touch, no effect. It doesn't affect you at all, right? Measles, mumps, all that stuff. It becomes different when all of a sudden you start seeing outbreaks, which it happens. So it's going to be interesting to see what happens over the next couple of years. I wish the people of Maine all the best. I hope they make whatever decision they make tomorrow. If it's made democratically, it's the right decision. Because I don't believe that we should ever live in a country where the people have no right to choose their own laws. So I just hope that if they choose to get rid of these new standards, that people don't suffer as a result. And I think that everyone involved and any onlookers would hope the same thing. So we'll see. We'll see if it passes. We'll see if it fails. But if this ballot resolution does pass and the law is repealed, you're going to see similar efforts around the country. Because ultimately, it didn't take all that many signatures in Maine to get this done. Now, Maine isn't a big state by any means, but I think it only took like 60,000 and change signatures to get this on the ballot. So it's surprising when you look around the country at how easy it is to get ballot initiatives on. Some states require it to go through the legislature, like Texas, but it's surprising to see how easy it is in a lot of places to get these measures on the ballot. So if this goes down in Maine, if that law is repealed, expect to see more states following suit. It's going to be interesting. It's going to be interesting. Well, we'll definitely cover this as the vote comes in, and we will keep you guys updated on whatever it is.